Okay, so welcome everyone. I'm Dr. Casey Jones, in case you don't know me yet. And tonight I wanted to talk with you about mouth breathing and sleep disordered breathing in children because I think it's such an important topic that needs to be talked about more. And I'm grateful to have this opportunity to do this with you guys. So the first thing that I wanted to go through is that a few things, just kind of housekeeping. So thank you for being here, and please stay muted initially. You are more than welcome to ask questions at the end. Please write down any questions. Feel free to put them in the chat. I will try to check the chat at the end, but it's about a half hour of stuff that I have to present here, and we'll go through that first. I did want to give a big thank you to Dr. Loud at Whole Health Dentistry, who has inspired me to do this series. This is the third in a series of basically webinars that I've done on dysfunctional breathing and sleep apnea and such. And so I'm grateful that she started me on this journey. So why me for this? I believe that we all do the best that we can until we know better. I admit that I do not know everything, and I never will. My promise is that as I learn more, I will share more. And my goal tonight really is just to empower you to notice if there might be a problem and to give you a feeling of hope that there may be a solution. My disclaimer is that I'm not a perfect parent. I don't think anybody is, and there's no dress rehearsal for parenting. So we do our best until we know better. And there's no point in feeling guilty about something that you can't undo. So if you find yourself getting into that space tonight, then just congratulate yourself for being here, have the grace to forgive yourself, and figure out what you can do moving forward. Sometimes you just have to be the parent and not the dentist. So there are so many people that can be helpful in this journey of breathing and helping our children to become healthy, and you can't do it all. So you need to lean on the collaboration of a lot of people along the way. And for me, that was Dr. Lauren Ballinger, who is in the Berkshire. She's wonderful, and she helped treat my son with myobrace and also some palatal expansion. And then when we moved to Wilmington, we have Dr. Sarah Pless, who's also fantastic, and she does some Healthy Start, and she's worked with my son. And then my daughter has been working with Campbell and Covington. That's Dr. Covington right there. And there's more than one way to treat things. So she's in Invisalign. There's different ways to do it. There always is. What is sleep disordered breathing? If you haven't heard any of my talks before, this is how I think of it. It's a spectrum, and it starts with normal breathing on this end over here. And then you have noisy breathing or mouth breathing in children especially. So sometimes you hear that as you come into their room, and sometimes you even see their head sort of tilted back with their mouth open as they're sleeping. That means they're trying to open up their airway. Then you go into snoring. So snoring is the first sign that there's an obstruction. We do think it can be cute in kids, but it's not cute. It's a sign that there is a problem and it's not normal. There's also obstructive sleep apnea. So that's where the kids really do, or adults have difficulty breathing. So it might be upper airway resistance, or it could actually be stopping breathing while you're sleeping. And that can range from mild, moderate to severe. Now on the bottom, there's insomnia, and that can play a role in both of these parts, because sometimes the body is so smart that it knows that if you go to sleep, you're going to feel like you're suffocating, and that's kind of terrifying. So in order to protect itself, it actually keeps the child or the adult from being able to fall asleep. There's also insomnia where we just can't turn ourselves off. There's so much stimulation in the world these days. There's iPads, there's video games, there's just so many things coming at these kids, and it's hard for them to unplug and shut down and let those let that adrenaline levels come down. So understanding sleep study results, this is really just meant to show that sleep disordered breathing or sleep apnea, obstructive sleep apnea, is a little bit more serious even in kids than it is in adults, meaning that if that child stops breathing even one time in the night, then they're considered to have mild sleep apnea, which with adults, it has to be at least 5 times in the night, because stopping breathing is normal, apparently under 5 times an hour. So just in kids, I think I misspoke, it's less than 1 time per hour for them to be normal. So 80 to 90% of these are undiagnosed, which is the scary thing, because I feel like a broken record as a dentist. Almost every patient that I see, whether it is a child or an adult, I'm looking for signs of sleep disordered breathing and dysfunctional breathing. And it feels like a conversation that I'm having with everyone. And I think that it's because of this, that 80 to 90% of the people who have it are undiagnosed. And breathing is important, but so is sleep, especially in a growing child. The good news is that only 5% of children have obstructive sleep apnea, but there is an estimated 30 to 35% that have sleep disordered breathing, which includes mouth breathing, snoring, upper airway resistance, obstructive sleep apnea, which is thankfully only 5%, chronic congestion from allergies, chronic upper airway respiratory infections, and habitual mouth breathing that causes nasal disuse. So they're just used to breathing through their mouth. It's a habit, and they're not using their nose. They can breathe through their nose, but they're just not. Just because something is common does not mean it's normal. You're going to hear me say that a lot tonight. Sleep disordered and breathing in children looks like this. And if you look at this list, I feel like there's something on this list that basically every child has. It's so common to see these things. You see mouth breathing, you see snoring, you see tooth grinding, you see enlarged adenoids and tonsils, you see chronic allergies and eczema, asthma, ADD or ADHD or lack of focus. The kids are so tired that they're moving to try to stay awake. You see defiant or aggressive behavior. You know, you're kind of grumpy if you don't get sleep. Depression and anxiety. Oftentimes you're not feeling very resilient if you haven't had the sleep. And I wish that it was more common to have our sleep looked at if people had depression or anxiety, because I do think that it's more related than we realize. Peer problems, you have friends, bedwetting, your body just doesn't shut down enough, so you're still producing everything. You're not in that rest and digest, and you wake up to go to the bathroom or don't, and that's what results in the bedwetting. Difficulty in school, delayed or stunted growth, fitful or restful sleep, nightmares, night terrors, morning headaches, daytime drowsiness, frequently wakes up at night, sleep talking or walking. So 92.6% of symptoms will not self-correct, and 30% will worsen with age. Oftentimes we're told, oh, your kid will grow out of it, but they won't necessarily. In fact, the majority of them won't. So again, just because something is common does not mean that it's normal, and certainly doesn't mean that it's healthy. Muscle wins every time. Some chronic things that can influence development are pacifier or digit sucking. So I sucked my thumb when I was a kid. Actually, it was my finger, but it's more common to be your thumb. And what that does is it puts your thumb in a place where it presses on the roof of your mouth, so it shapes it in a certain way, and it affects how the teeth form around it. So this is a perfect illustration here. I love Dr. Stephen Lin. He wrote The Dental Diet, and he's great on Facebook to follow. But this is one of his visuals that shows what happens when you have that thing constantly between the teeth, and it affects the muscles here of how everything develops. They have this open bite, they have a narrow palate. This again shows how the roof of the mouth, instead of being nice and wide where that tongue can rest up here and have these nice teeth that are aligned here, it's more of a V shape. It's more of a high vaulted palate, meaning it's really kind of tall. And if you think about it, the roof of your mouth is the floor of your nose. So if you have a narrow roof of the mouth, it could mean that you have less space to breathe. There's lack of prolonged breastfeeding or bottle feeding can affect things, but again, I don't want anyone to have any guilt over this, because there are various things that can come into play with that. And I have seen plenty of kids who have breastfed who still have the crowding and the airway issues and all of that. So that's not the only factor that comes into play. And I know I had some difficulty with my first child with breastfeeding. Mouth breathing, chronic open mouth posture. So if the mouth is constantly open, this is how I see my kids half the time when they're playing a video game or watching TV. And it's something that, you know, I'm constantly working on, but it does definitely affect how the muscles will develop the face. And we often see longer faces. The next thing that we'll talk about is the airway obstruction. So if you have adenoid or tonsils enlarged, it's going to make it harder to breathe. So it's going to make that child breathe through their mouth. But it's a vicious cycle because as they're breathing through the mouth, the only thing that's filtering the air are the tonsils. And so they actually get bigger. And if they would just start to breathe through their nose, sometimes those tonsils shrink again, and then you're able to breathe more easily. Lip or tongue ties, 20% of babies have tongue ties. And if there's a tongue tie, it affects a lot of things. So not only does it affect the ability to latch and to be able to nurse, but it also can affect speech. It can affect having the tongue in the correct posture to affect how everything develops and grows, because if the tongue is down in the floor of the mouth instead of up in the roof of the mouth, you're gonna see that long face posture. Incorrect swallowing patterns. So that means that sometimes we see kids who use their whole body to swallow, and it looks something like this. So they're using all these extra muscles to swallow instead of just using the tongue. And that again affects a lot of how things develop because the muscles are strong. The soft diet that we've developed also affects the facial growth because we're not using the muscles to chew in the way that we used to, which isn't affecting how everything grows with the jaw forward, with the strong jaw. We see the more narrow faces because we're just not functioning by chewing the harder things like we used to. So tongue ties are, again, these things are common, but they are not normal. Let's see, here we go. So why aren't the children developing the faces in the way that they used to? There's a lot of crowding that we see. There are some less space in the skulls. Essentially, it is evolution and epigenetics. So we are just developing smaller skulls and smaller airways. It has to do with our Western diet. It has to move with moving inside, with allergies that we developed, with all sorts of things. As we got more advanced, we just didn't grow the way that we used to. So teeth used to be straighter because of the fact that we had our tongue in the right position. We were breathing through our nose. We were chewing hard things. And now we're seeing these more narrow arches. We're seeing crowded teeth. It is so common to see those things. And I love these illustrations by Bex Burgess for Patrick McEwen, which show what can happen if the child is chronically breathing through their mouth all the time. As they develop, we're gonna see these longer faces. You're gonna see the jaw set back more. You're gonna see tired eyes. You're gonna see sometimes a crooked nose or a longer nose. It just develops the face differently. So some signs of airway related issues can be crowded, crooked teeth. So I saw the other day that 92% of people need to have braces. So that to me is a weird way to put it, because I look at it now as what's going to be a healthy foundation, something that they can keep clean, something that you can breathe with, a functional smile that also happens to be beautiful. So crooked teeth, crowded teeth tend to be harder to keep clean. I see a lot more decay, and it usually means that they're also having some airway and breathing issues. We see a narrow arch and a higher vaulted palate, like we've mentioned before, narrow nose, a long face, the underdeveloped jaws and faces, more cavities and red swollen gums or gingivitis. If they're breathing through your mouth, everything gets dry too, so you're going to be higher risk for those bacteria, causing decay, causing gum disease. Dark circles are what we call allergy shiners. You see those dark circles under the eyes. Sometimes eczema can be related because there's a lot of inflammation in the body. Chronic nasal congestion or stuffiness, and obesity. So obesity is an interesting one because obesity and type 2 diabetes are becoming more common in children, and that's for various reasons, but sleep deficiency may be contributing because hunger hormones can be out of balance if you're not getting enough sleep. Resistance to leptin and overproduction of ghrelin make a kid hungrier. And then if that kid is eating and gaining weight, then sometimes the weight actually affects the size of the tongue and the airway, and it becomes even harder to breathe, which then it becomes even harder to sleep. And then these hormones are all out of balance, and it's a vicious cycle again. This is just another illustration. I love the Breath Institute. They're fabulous to follow as well. Shows the same ideas of the mouth breathing causing you to develop in a certain way. But the one on the right also shows this forward head posture that's so common. And that's because if the child is having trouble breathing, they are going to sometimes tip their chin up instinctively, almost like doing CPR. That opens up the airway, but then you can't see. So then you bring the head forward in order to level the eyes and be able to see, but then that gives that forward head posture. Now, if we develop with smaller jaws and more retruded jaws where the jaw is back more, of course, that's going to be closer to our airway. So this would be ideal jaw placement. And you can imagine, I would think of it like your child either breathing through a drinking straw or even a coffee stirrer versus a garden hose. So you would much rather have them breathing through a garden hose than a coffee stirrer or a drinking straw. So we want to make sure that we're trying to grow these airways and give them as much chance as possible. One of the ways that we can do that and can help is a system called Healthy Start. I'm trained in that, but there's lots of other ways to do it. MyoBrace is very similar. And this is the habit corrector. So it's something that the kids sleep in. I actually have one right here. It's soft. It has a position for the teeth to go into it. It also has a spot where the tongue goes up into place. So it's training that tongue to be up in the roof of the mouth and out of the airway. It brings the jaw forward a little bit so that they're then able to breathe better and there is more space in their airway. This is just one example of a Healthy Start case, a slide from Orthotane. And it shows that, you know, we used to think, okay, we're waiting until all those permanent teeth come in, the kid is 11 or so, and we're starting orthodontics, we're gonna give them a beautiful smile. And then we started to think, okay, now we're gonna intervene and we're gonna do some early intervention and try to grow them. And, you know, that was something that was often in 2 phases, and we're still doing that. But now we're trying to start to do things even earlier. So starting to do things with kids in all of their primary or baby teeth and try to help to grow the airway, grow the bone, and position things so that those teeth come in straight naturally rather than coming in crooked and then trying to correct them in that way. So some options to treat sleep disordered breathing in children are tonsil and adenoid removal, allergy treatment, which can include, you can try eliminating the 3 Ds first, which are dust, dairy, and dander, tongue tie release, palatal expansion, early orthodontics, or even orthotropics, which is kind of a newer thing where you're really growing the faces, myofunctional therapy, which is basically physical therapy for the face and the tongue. It's such strong muscles, the tongue especially, that if we can tone and train the tongue to get used to being up and out of the airway, up in the roof of the mouth, then if we have that tone during the day, even when we fall asleep and things relax more, just like any muscle, that's going to hold some of its tone more. Breath retraining means just because you have the ability to breathe through your nose doesn't mean that you know how to or that you can break the habit automatically. We can use PAP therapy or positive airway pressure. The most common one is CPAP on kids, but try to do it as a very last resort because it is going to restrict their growth. So if they have a mask on their face and it has to be tight in order to seal things and have that air and that positive pressure coming in to open up the airway, then that can press on the face and prevent that forward growth of the face and the jaws that we want to help grow the airway and actually make it long-term even harder for that child to breathe. But it's important that they do breathe. Myofunctional therapy and breath retraining were something that I wish were part of all of these solutions because I think that they're so important. So again, if you can breathe through your nose, that doesn't necessarily mean that you will breathe through your nose. So if you have your tonsils and your adenoids removed, it's not magic that that kid all of a sudden knows how to breathe through their nose. They need to be told and to be taught. Same thing with palatal expansion. Just because now there is room for that tongue to go up into the roof of the mouth doesn't mean that they know how to do that. So I wish that myofunctional therapy and breath retraining were part of all of these treatments. The nose is for smelling and for breathing. So breathing through the nose warms, humidifies, filters, and conditions the air. It harnesses nitric oxide, which is naturally produced in our sinuses. It's an awesome, fairly newly discovered molecule that we produce in our sinuses naturally. And if we're breathing through our nose, we get the benefits of it. It disinfects the air. It helps dilate the airway to keep not only our nose open, but the entire airway open. It dilates blood vessels. It even has been shown to kill the virus that causes COVID. And so they are actually trying to synthesize it to use it for that. But we do make it in our bodies naturally. And if we're breathing through our nose, we get the benefits of it. It promotes correct tongue posture, which promotes face, jaw, and airway growth. So we want the tongue to be up in the roof of the mouth. And the easiest way to figure that out, there is this little space right behind the front teeth. It's called the incisive papilla. And if you put your tip of the tongue up there, like you're going to click it, or like you're going to say or click, that allows you to see where that spot is. But if you just have the tip of the tongue up to the roof of your mouth, then you can still easily breathe through your mouth. But if you put your tongue up where it should be so that it's touching all of these stickers here, and it's up there as if you're going to click your tongue, but you're holding it in position. So if you have it up there right before you click and it's suctioned up in the roof of your mouth, and then you try to breathe through your mouth, you probably can't. So give it a try. So having your tongue up in that position actually makes you have to breathe through your nose. So having the correct tongue posture promotes nasal breathing. It increases resiliency by triggering the parasympathetic nervous system. It promotes diaphragm breathing, and it eliminates mouth snoring. So if you're snoring through your mouth at night, it's like this. But if you close your mouth and you try to snore like that, you can't. So just closing your mouth can eliminate some types of snoring, because as you open your mouth, for every millimeter that you open your mouth, you actually close off the airway. And so it's easier, it's better to have that mouth closed as you're sleeping, and eliminates that mouth snoring. So the question really becomes, can your child breathe through their nose? Is it a habit or is it obstructed? Patrick McEwen always says, if you can breathe through your nose for 1 minute, you can breathe through your nose for life. This book, Close Your Mouth, is one that I recommend all the time. It's a short read and it explains things really well. One of the things I like to tell parents and that I like to use is that you can create a code word or even a symbol. So if you catch your child mouth breathing, you could say something like pickles, so that they are the only ones that know what you're talking about. You're not going, close your mouth all the time. Or you could tap your chin or something like that to give them the signal to go ahead and close their mouth. So there are ways to actually tape your mouth shut. And one of the ways that I love to talk about is using myotape, because it goes around your mouth instead of across the mouth. So it's easy to open your mouth, to talk, to drink. There's nothing to keep you from opening your mouth. So certainly you're not going to want to do this in someone under age 4 that can't take it off themselves, and always use your judgment. But there is a link here. The QR code is for myotape. It looks basically like this. It comes in 3 sizes. This is the medium size actually, but there's kid sizes. Here's what it looks like after you take it off. It's sort of stretchy, and then you put it around your lips, and it just sort of keeps them closed. So there's certainly no reason that while I'm sleeping, if I needed to open my mouth for any reason, or if I wanted to put it on during the day to remind myself to keep my lips closed, I can still function, I can still talk. And that's something that you could even have your kids do while they're doing their homework, while they're watching TV, while they're doing some sort of technology time, whatever it is. But there are other ways to do it too. So in addition to the myotape, you could buy something like a kinesiology tape. It doesn't really matter what brand, but it's the tape that they use for physical therapy, basically. So it's a different type of stretchy tape. I usually get the sensitive skin one, and you can cut it into strips, and you can put it underneath your chin, or you could put some that goes underneath and then across, which is the same idea as the myotape. And again, you can open your mouth. There's nothing to stop you from doing that. It's just trying to remind those muscles to keep your mouth closed, especially while you're sleeping and you can't remind yourself. If you've ever read Breath by James Nestor, his favorite way to tape the mouth is to use 3M micropore tape. It's super inexpensive and it comes in rolls, and you can do it that way too. I've done it that way, but it does go across your lips. So you take a little piece of that, and the easiest way is just to fold down a little bit of each side. You make it a little less sticky, or I do anyway, by putting on whatever I'm wearing. When you put it over your lips like this, and then you can certainly still talk. You can open this part here, and you can easily take it off. So those are some ways that you could consider doing it. And I did make a YouTube video, so that's what this QR code is right here, if you're interested in watching that. Other things that you can do, Clear is something that I love. I always have it on hand and use it in myself, on myself, and with my children. And it's a nasal spray that's natural. It's xylitol. As a dentist, I love xylitol because it helps fight cavities, because the bacteria that causes cavities can't digest it. So we use it for those purposes, but also it's great to clear the sinuses. They use it for ear infections, all sorts of things. There's myofunctional therapy, like we talked about, where you're trying to train the muscles of the tongue and the face and everything to help that child grow. The Buteyko Clinic app is free. You can download it. There's a part for children. He always wanted to keep everything free and accessible for children. It goes through a lot of the breathing exercises. And so that's something that you can check out. The Hoberman Sphere is this. And what I love about this for kids is that my kids, at least, love to always have something to kind of fidget with. So this gives them something to hold, but they can use it to concentrate on their breathing. So it works on cadence breathing, especially because it slows down the breathing. So you just basically breathe in as it goes out and out as it goes in. The kiddos can hold it right in front of their belly and just focus on this for, 3 to 5 minutes, whatever, to give them something to do. Because I know I'm better with movement, but kids oftentimes are too. The last thing I have here is to use an exercise to decongest the nose. So it's a natural way to clear your nose. And what you would do is that you breathe in and out of the nose normally. And then after you exhale, so you breathe in, you breathe out, you pinch your nose, and you're going to nod your head up and down as many times as you can until you feel like you have to take a breath. And then when you have to take a breath, you would let go and you would breathe through your nose. So I tell kids, pretend that you're swimming. You can nod the head up and down. They can walk around and see how many steps they can take. They can sway side to side. They can shake their head no. whatever it is, it doesn't matter. It's really just a distraction, but trying to hold the breath as long as they can until they have to take a breath, but it needs to be through the nose, because all of that nitric oxide that just got pulled from the sinuses, we then breathe in and it opens up that airway. After doing that, they can rest for like 30 seconds and then do it again, and do it up to like 6 times right before going to bed. And that can help clear their nose before going to bed. This is another slide that I love from Orthotane. It just shows that collaboration is key with this sort of stuff. And there's a lot more people that could be on this, I'm sure, but certainly the pediatrician, sleep physician, dental professional, ENT, myofunctional therapist, allergist, whoever it is, it takes a team to get our kids healthy. So here's some resources that I just wanted to put out there. For me, I've trained in Oxygen Advantage and Buteyko Clinic. So Buteyko Clinic is a wonderful resource. Like I said, you can get the app, download that has exercises on it for breathing, especially for children, but even for adults, there's some exercises on there too. Healthy Start is something that you could look into, or MyoBrace, or talking with your dentist, orthodontist, any of those sorts of things, just to open up that conversation about the airway, about crowded teeth. What can we do? Is there something that we can do now? Just opening the conversation. But these books that I have listed here are some that I love, and there's probably more because I read a lot of books and they are fantastic, but Close Your Mouth is a great one. GASP is awesome. JAWS is fantastic. The Dental Diet is a wonderful one that I referenced Dr. Stephen Lin earlier. Brave Parent, I most recently read that one, and it's a thicker book. I probably have it here somewhere, but it's great. It talks not just about breathing, but it talks about, dental health. There's so much great stuff in there that that I love talking about, and I learned some stuff in there too. So, and I want my husband to read it, so I'm not the only one talking about these things. And then of course, Breath. That is the one that really got me started on this journey. It's fabulous. It's an easy read by James Nestor. Highly recommend it. And that's really all that I have prepared. There's so much more that could be talked about. So I'm hoping that there are some questions, and I'm going to see if I can maybe make it like this. Oh, hold on, sorry. There we go. So feel free to come on video if you want. You can unmute yourself. Yes, and Bank's hand is raised.
Hey. I was curious if you could talk a little bit more about your Healthy Start program. I know you said you have been certified in that. I was wondering if you could kind of elaborate.
Mm-hmm. So Healthy Start is a system where essentially you are starting these kids off, ideally age 6 or so, as the teeth are just starting to come in with those permanent teeth, so that you can guide them to grow. So it's a series of appliances. The first one that tends to be used for most people is the habit corrector that I talked about, because oftentimes there is some sort of habit to correct, whether that is that they are mouth breathing, whether that's that they're tongue thrusting, so their tongue comes forward every time that they swallow, whether that's sucking a thumb, something like that. That helps to correct that, because they can wear it during the day, but certainly at night, if you have this in place, you can't have a digit in place. It's just not possible. And then there's also a series that guides those teeth to be able to grow, because if they grow into the right place, they can help the bone grow in that way too. So it's considered, a natural way to do braces. There oftentimes does still need to be some expansion that's done in other ways. Same thing with my child doing the MyoBrace, which is very similar system. He did the MyoBrace, but still needed to do palatal expansion. So you kind of have to figure out what works best for the child, but it's a great thing. And the nice thing is that there's nothing that's attached. It's all removable appliances, and they don't have to be worn full time. So sometimes it's only at night. Sometimes there is some active wear during the day.
Depending on what the, so depending on what the issue is. Some are
Exactly.
worn at night and some are worn during the day, and then some are all the time. Okay.
Yep. And there's a treatment plan for each child. We do a digital scan to figure out what's needed, what's recommended, and kind of go from there.
Okay. Perfect. Thanks.
Yeah, you're welcome. Other questions? Let's see here. I see there might be a couple in the chat. Okay. So yeah, I think I recommended more than 3 books. So let me try to go back to that slide. Oop, hold on. So breath was one of them, but here's some that I love. So JAWS, GASP, dental diet. I actually don't know. I know that GASP, Brave Parent, and dental diet were all written by dentists. I'm not sure about JAWS, actually. I don't think so. But anyway, they're fantastic. They're all very good. And when do I recommend a sleep study for a child? That's a tough one. So I did do a sleep study with my oldest, and we did a hospital study, and it came back that he was fine. But he's not. He definitely has those tangled sheets that were all over the place. He was snoring. He was having difficulty breathing. He was bedwetting. He was waking up a ton. He was having the night terrors, all of the symptoms. So the good news is that typically it's not full on sleep apnea that we're seeing in children. It's sleep disorder breathing where they're struggling to breathe, and we can help them get better before hopefully it becomes a problem and becomes sleep apnea. So certainly if you are witnessing them literally stopping breathing, you would want to have a study, and it never hurts to have a study. It just may not show up in children because a lot of times it's not the apnea, thankfully.
So can
Please.
can you hear me? Okay.
Yes.
I think that's my struggle with like children and myofunctional therapy is you want to save your tushy in a way and make sure that all the bases are covered because obviously it's out of my scope. But then I also feel like anybody I send them to, the sleep studies aren't read properly, or they're really not analyzing everything on that sleep study, and they're just kind of looking at one number, and I struggle on where to send them or who to go to. Or is it better just to do something better than nothing? That's where I'm kind of stuck with some people, I think.
Well, I do believe that it's always better to do something rather than nothing, right? If you're doing myofunctional therapy, you are training the muscles in the airway to try to get that tone to keep things open. And sometimes you can see an improvement. Now, it's always hard to make that call. And I think that the pediatrician has to come into play with that. But even in adults, a lot of times you will know that there are some sleep issues that are happening, but they're not that typical sleepy adult who's likely to fall asleep while, sitting still, or doesn't pass the screenings that we have to really look like they have sleep apnea, and so they don't order the test. So I think it's still a growing area. I think there's more knowledge that we're gaining in it, and I think that things will continue to evolve. And definitely I don't have all the answers. I struggle with that too. I struggle with, what exactly do we do? When do we do it? You do the best that you can, and try to help in any way that you can, I basically think. Does that help?
Yes, absolutely. Thank you.
You're welcome. Let's see. I think there's a question here that says, is it possible for a child to develop sleep disordered breathing after, oops, sorry, I just lost it, after a tongue tie release if there's not enough tongue space? Yeah, I'm not sure. I can't really speak to that question because I'm not an expert in tongue ties for sure. But what I would say is that if a tongue tie, I guess it depends on what age you're talking about, because in an infant, when we do tongue tie releases, there's not going to be any myofunctional therapy associated with it. But when you are doing that in a child who can, or in an adult, you're going to want to do myofunctional therapy before you even do the tongue tie release, so that that tongue is ready to go where it needs to go and it's been trained. Does that help? typically releasing the tongue helps it come up and out of the airway rather than making it fall back. But we definitely want that tongue to have the strength to do it. And we do want the tongue to have the space to be there too. There's a lot of pieces that come into it. Okay. Jen, do you have your hand raised?
Yes. Hold on.
Okay.
Can you hear me?
I can. Yes, absolutely. What's your question?
My question, I don't know if I missed it. At what age do we think in children or adolescents that we think the growth is done, quote unquote, with the airway, that it's hard to gain more access with movement and whatnot? I'm struggling with, I guess, with clients and patients of them asking at what age, was it hard to create more room if, based on Malampati and things like that?
Yeah, I think I don't have an answer to that, unfortunately. And I would love to know what the answer to that is. The only response that I would have to that is that I think that depending on who you ask, there can be changes even in adults. So the idea is that the sutures of the face and things don't truly fuse until a very advanced age. I may get this wrong. I don't have the study in front of me, but I feel like it's the 80 when you turn into your 80s or so. So there still is the possibility to do some expansion. And so there's some that do some removable appliances. Again, it depends on who you talk with about this stuff. And it depends on what's causing the problem. So if it's a Malampati issue and it's that soft tissue, strengthening, doing the exercises and getting that tissue to be more toned can help, but sometimes there is just a structural issue. And so if you have sleep apnea and you're an adult, for example, and you've done all the things to do the breath retraining and whatever, PAP therapy is the gold standard, but it doesn't work for everyone. Not everyone wants that constant pressure. So there's other options like doing, a mandibular advancement appliance, which really is just intended to keep that jaw from falling back into the airway, to help that tongue to stay forward a little bit. It's actually been shown to expand the airway laterally, strangely enough, even though it brings the jaw a little bit forward. So I just don't think that we have a good answer for that yet, or I just haven't learned that answer yet. It's still learning a lot. Does that help?
Yeah. Would it be better reworded as the ideal age is there an ideal age to manipulate the airway that you want to complete?
I would say as early as possible, right? If you know and you can catch it. So something I didn't mention is that I see babies sleeping now, and if their mouth is open, I just want to go and just close it. Because obviously you wouldn't want to tape their mouth shut, but you can, even in James Nestor's book, Breath, I think there was a little bit on there about how they used to have a sleeping baby and then just gently close their mouth as they were sleeping. And if you do that and get them into the habit of sleeping with their mouth closed, then it does become a habit and you can catch it early, because there's so much growth that you can influence on that child. Again, if you catch it when they're, still in their baby teeth and they're like 4, you can start them off in therapies like Healthy Start really young. So, 4 years old, put them in a habit corrector type of thing, and, get them, get that thumb out of there, get their mouth closed, get them breathing through their nose. If you can change it, you can affect that growth pretty early on. Same thing with vice versa. I don't remember which research paper it was, but one of the Zoom trainings I had with Patrick McEwen, he showed this article about a child who was, face that was round and defined jaw and such, and then got a pet that he was allergic to, and his face changed completely. It was this long face, open mouth, and just, sunken eyes, and he looked miserable. But, things that change like that in your environment can change things. So we're finding the earlier the better. And I'm certainly learning more and more about that and have even more continuing educations lined up. But I think it's exciting to be able to start even earlier in kids.
Great, thank you.
You're welcome. Anything else? Let's see, I don't think I missed any over here, but I'll check. Nope, I don't think so. Well, if there aren't any more questions, then I guess I would say thank you so much, everyone who did attend. And I will put the recording up on YouTube. So if anybody missed this, I'll have that there. And any last minute questions before I sign off and say have a great night? All right, well, I'll go ahead and stop the recording. Have a great night. Don't forget to smile and dance. Look for the blessings, and I promise you'll see them. Thank you so much.